Hello, ladies and gentlemen. Welcome to another episode of Women's Health Today with Dr. C. I am Dr. Leroy Campbell, also known as the Women's Health Doc, and happy to be with you one more time. Today, we're going to be talking about a very important topic: painful sexual intercourse. Of course, you can imagine that for many reasons, this is something that's worthy of discussion and important for women to know about. And we'll get into that. Our aim today is going to be to answer three main questions. One, to talk a little bit about what painful intercourse is, the different types of painful intercourse. Two, why it's so important for us to know and be aware of this. And then, of course, thirdly, we're going to look at some of the possible causes to see how it is that that information can be useful for women in understanding what may be happening and to know when there might be something serious going on and what to do about it. Okay, so let's get to it. First of all, when we talk about painful sexual intercourse, the medical term for this is dyspareunia. As you go along in these videos, you learn a little bit about the medical jargon because I know sometimes when we as doctors begin to talk, especially among our colleagues, it sounds like a different language, and it really is. Many of the words that we use are based in Latin. So there's the medical jargon, and the word for that is dyspareunia. So anytime you see dyspareunia, then you know what it really means is painful sexual intercourse. When we talk about dyspareunia or painful sexual intercourse, it's important to understand that you have two levels, you have two types. We tend to classify dyspareunia into superficial and deep. And what that means is really speaking to where exactly is the patient experiencing the pain? Is it that the pain is coming on penetration when the penis is entering, or is it on the inside when there's thrusting? And so, generally speaking, when we talk about superficial dyspareunia, we're talking about pain that is being experienced at the introitus, which is the opening of the vagina, as the penis is entering. And then deep dyspareunia is really speaking most times to pain that is arising due to issues higher up. So this is a very useful classification of the symptom so that it allows us as clinicians to begin to get an idea as to what may be happening. So let's get further into this. Why is it so important for us to actually talk about painful sexual intercourse? Why is it so important for us to have this conversation? Firstly, painful sexual intercourse is something that, as you imagine, can affect a woman's quality of life. Okay, it can significantly affect a woman's quality of life because sex, let's face it, is an important part of life for most people, both from the standpoint of pleasure within relationships, bonding within relationships, but also from the standpoint of reproduction and childbearing. So the reality is that if one's sexual experience is unpleasant, then it's certainly going to affect the ability to perform sexual duties and responsibilities within the context of a relationship. And that can place significant strains on a relationship, leading even to the loss of a relationship. Okay. And I've had cases where, couples have come in and to the point of frustration there where a woman and her partner having seen serious challenges because her desire for intercourse has been affected by the discomfort that she experiences during intercourse. And so consequently, that has placed immense strain on the relationship. And the husband or the partner is now dissatisfied and very much concerned. And sometimes, even for men who are supportive of their partners, they still want to know what's happening to see how it is that they can help them to improve. So, the first thing we must understand why it's important to have this discussion is that it can affect the quality of a woman's life and then have impacts on a relationship. The other thing that's important to understand is that when we talk about painful sexual intercourse or dyspareunia, it's not just the issue of the dyspareunia itself, but the dyspareunia being a symptom may actually just be an indication of some other, perhaps even more serious underlying pathology, some other problem taking place that could place your life at risk. And so, consequently, it's very important that we want to talk about and for you to have good information. All right. The third reason is because it's common. It's the prevalence varies between 3 to 20%, right? And it depends on the stage of life that you're in. So if we're saying something is occurring as frequently as 20%, then it means that 1 in 5 women will experience painful sexual intercourse at some point in their lives. And oftentimes it's affected by different factors, age, etc. And we're going to get into that as we go further along. So we understand now that it's important for us to have this conversation because one, it can affect quality of life. Two, it may also have an indicator of some underlying disease process that could place your health at risk. And then thirdly, because it's so common, it's quite possible that even if you have not experienced painful sexual intercourse, that it's something that you could experience in the future. So it's very important for us to have this discussion. So let's take it to the next level now. Let's get deeper into this issue and to begin to look at what are some of the possible causes of dyspareunia or of painful sexual intercourse. All right, let's get into that. All right, so as I said before, one of the key things is to separate this into whether we're dealing with superficial or deep. We mentioned before that the superficial is really talking about pain experienced when there is penetration during the process of entry. Superficial dyspareunia usually indicates that there may be issues that are affecting either the vulva, the vaginal introitus, or the pelvic floor. Okay. Many times, I hear women refer to everything as the vagina, but the vagina is really just the tube that starts at the vaginal opening that connects the vulva to the uterus and the cervix. Okay. So this is the vulva, and it's made up of the outer lips. We call these the labia majora or the major lips. And then you have the minor lips on the inside. We call these the labia minora. And these are important for protection of the very sensitive organs in and around the inner part of the vaginal opening. So, for example, we have the opening of the urinary tract here, the urethral opening, and then we have the clitoris here, which is the very sensitive organ. It with many nerve fibers there, and is actually the site of most sexual stimulation. So, very important organ, and these are protected nicely within the labia major and minor. Just below this, not visible here on this image, but just deep to this opening are the pelvic floor muscles, which stretch from the pelvic, I'm hoping I need to get my pointer here, hopefully. Okay, now it's probably visible, but so we're saying this is the clitoris, these are the labia minora, labia majora, okay? And this is the vaginal opening, otherwise called the vaginal introitus, right? And we're saying deep to this are muscles, right? If we were to be able to look underneath the vulva, there is a layer of muscle called the pelvic floor, which stretches from the pubic bone, that's the hard bone that you'd feel at the front here, just at the lowest part of your abdomen, and it will stretch all the way to connect to the sacrum at the back. All of this area is supported underneath by the pelvic floor muscles. Okay. So when we talk about superficial dyspareunia, we're really talking about issues that are affecting either the vulva, the vaginal introitus, or the pelvic floor muscles. Very key. All right. So anytime we're dealing with superficial dyspareunia, we're usually dealing with issues affecting one of those three areas. Okay. So let's get back to our image now. I think we've been able to find a more suitable image for us to use. So you're learning a little bit of genital or pelvic anatomy. The pubic bone would start at the front here. You'll be able to feel this just below the lower part of the abdomen, and the muscular sheath, the pelvic floor muscles, will be underneath all of these tissues, spreading from the front to the back and supports everything here. Okay? So essentially, when women are urinating, for example, and they hold the urine, that's a function of the pelvic floor muscles. When a woman contracts squeezes the vagina, that's a function of the pelvic floor muscle. Okay? So if it is that there are disorders of the vulva, vaginal introitus, or the pelvic floor muscles, it can present with painful intercourse, and this classically is going to be would be a cause of superficial dyspareunia, so pain during entry. So let's look at some of the examples. For women who are, let's say, have never had intercourse before, you will find that the hymenal ring, which is a ring of tissue surrounding that covers partially the vaginal opening, is still intact. And this has nerve endings going to it. And so during intercourse, initial intercourse can be painful because the tissue here breaks down. And that's the reason why women, for example, if they've had their first sexual experience, may find that there is some bleeding because it's the breaking of the hymen that's causing that, right? And also women may find if they have not had sex for a long time, then the initial penetration may be quite painful. And that may not indicate that there's a problem. That may just be a normal process, right? Then, so there are sometimes, however, where the vaginal opening can be affected because of scar tissue. So let's say women who have had previous surgical procedures or even vaginal deliveries, and there was trauma to the tissues of the introitus that didn't heal well, or there was excessive scar tissue because of how the surgery was performed or how the area was repaired, then it can cause narrowing. You can have narrowing of the vaginal opening. What we call, the term here is vaginal stenosis. And this now causes painful intercourse because, of course, the tissues have to stretch quite significantly each time there's entry. Occasionally, it may not be an issue per se of anything to do with the woman's anatomy, but rather actually contraction of the pelvic floor muscles. Sometimes the pelvic floor muscles actually go into spasm, what we call vaginismus, or the modern medical name, myofascial pelvic pain syndrome. Don't worry about that fancy name. Essentially, the issue is that for some women, the pelvic floor muscles that surround the vagina actually go into spasm. The muscles contract very vigorously and tightly whenever there is a thought or the act of penetration. And as a result, now causes great pain. Sometimes the penis may not even be able to enter. And this is quite often a significant source of discomfort for patients. And sometimes may even preclude doing a physical examination when they go to see the doctor. And quite often, it's happening on the background of perhaps a history of trauma. Women with vaginismus or myofascial pain syndromes do have a higher prevalence of previous history of whether it is sexual abuse or some kind of negative experience associated with the genital area, whether it is due to some negative experience after a surgical procedure. There is usually quite often some kind of factor that creates high levels of tension and then predisposes women to this issue. And it can be a quite complex issue. And I'll probably put a link down below of other videos that we'll speak a little bit more about vaginismus as it relates to a cause of painful sexual intercourse. It may also be that there's a very large male member. The penis might be very large relative to the introitus, and so consequently there may be discomfort. All right, so that's the reason why when you go to the doctor, we're going to go through the history to try and get an idea of what could be the underlying cause. Other things that could give rise to superficial dyspareunia would include inflammatory conditions in and around affecting the vulva. So, for example, if there is a yeast infection that's causing inflammation there, if there is herpes infection or flare of previous herpes infection, you may have ulcers on the surface of the vulva that could cause pain because of friction and irritation. Sometimes these little glands, these openings at the side here, these are called Bartholin glands, and they secrete mucus that helps to lubricate the vagina during intercourse. So many times you'll hear the term used that a woman gets wet, or when she's aroused, it's actually speaking to lubrication that is produced from the Bartholin's glands. Now, what's important here is that sometimes these glands, the mouth, the opening of the glands can become blocked, and you end up with what's called a Bartholin's cyst, all right, or Bartholin's abscess if that cyst becomes infected, where there's a swelling, a painful swelling there, and that can also affect intercourse because penetration will then lead to pain, right? We can also talk a little bit of non-infectious causes of inflammation in this area. And this is particularly useful when we get into the postmenopausal age group. A younger woman can have non-infectious causes of inflammation. So, for example, it can be, inflammation related to the use of certain products, perfumes, etc., on the surface of the vulva, which can cause irritation, which is why it's so important to be careful about what's used there. But you can also have inflammation because of underlying conditions that we don't really know the cause for. Sometimes we can't identify a specific cause for the inflammation. This tends to be more common in older women who have gone through menopause. Quite commonly, you'll have a condition that's called lichen sclerosis, which is where you get chronic inflammation of the vulva, and over time that leads to thinning of the tissues and loss of pigmentation. So the vulva actually becomes darker, lighter in women, especially for women who may have African descent who have darker pigmentation. It becomes even more obvious and can be quite distressing. And this may present with burning, irritation, sometimes itching, and certainly pain during intercourse. Far more common, however, than lichen sclerosis is inflammation as a result of low estrogen levels in women who are postmenopausal, because estrogen plays a very, very important role in maintaining the integrity of the tissues of the vulval area. And so consequently, the tissues become very, very frail and easily bruised in the presence of low estrogen levels, what we call atrophic vaginitis. And as a result, patients may experience quite a bit of discomfort during intercourse and may benefit from lubrication in those cases. All right, so we've spoken about superficial dyspareunia. We're going to talk a little bit about deep dyspareunia, and then we'll wrap this up. When we talk about deep dyspareunia, as I mentioned before, we're talking about pain that you're experiencing during the thrusting process of intercourse. You'll have pain, and that's really what we're referring to when we talk about deep dyspareunia or pain on deep penetration. And most of the time, if that's happening, it usually indicates either one of two things that's taking place. And one is either there is a cause for inflammation within the pelvis, right? There is something causing inflammation within the pelvis. There's something causing inflammation within the pelvis, or there is something distorting, right? Or causing distortion of the pelvis. So it's either inflammation or distortion. And when we say distortion, what we mean is that something is affecting or changing the anatomy or the relationship between the structures on the inside. And that's important because if you think about it, during deep penetration, the penis goes all the way in back to the back of the vagina. And during thrusting, you have movement of the pelvic organs, right? And so if there's inflammation there, then inflammation is going to cause irritation whenever there is thrusting, right? And if there's distortion, meaning there's something affecting the relationship of the organs, then you may find that thrusting may be causing the stretching or compression of structures that should not normally be stretched or compressed during intercourse. All right, so what are some of the things that can give rise to inflammation? Well, perhaps the most common reason for inflammation is infection. For example, you can have what we call pelvic inflammatory disease, which is where an infection ascends into the uterus and involves the fallopian tubes as well. So infection in and around the uterus can give rise to pain during intercourse. Even infections involving the bladder, because the bladder sits right in front of the uterus, or if there are infections related to recent surgery, that can also give rise to discomfort. The other, probably more common reason when we talk about chronic dyspareunia, meaning ongoing dyspareunia, certainly over the course more than 3 months or so, the more likely cause is going to be something like endometriosis, which we have had other videos on that, both here as well as in the Women's Health podcast with Kim and Dr. C. We've spoken extensively about endometriosis. So if needs be, you can catch one of those videos. But endometriosis is also an important cause of inflammation within the pelvis and can lead to pain. So what are some of the causes of distortion of the anatomy within the pelvis? And in this case, we tend to have distortion occurring either as a long-term sequelae or side effect of chronic inflammation, or because of some kind of mass or space occupying lesion, right? So let's deal first of all with scarring. If there's chronic inflammation, so for example, pelvic infection that has not been addressed, has not been appropriately treated, then over time, the body responds by trying to wall off the areas of infection, and you get what we call scar tissue being formed. This can happen also in the case of endometriosis as well. And scar tissue just means that different structures, for example, the ovaries might get stuck onto the uterus, or the uterus may get stuck to the bowel or to the bladder. Consequently, whenever there is a thrusting of intercourse, you get stretching of the scar tissue, and that causes pain, right? When we talk about space occupying lesions, what we're talking about are masses or some growths, tumors within the pelvis that could be moving structures out of place. And it's actually now, when during intercourse, that disruption of the space may lead to compression of different structures. So what are some of the examples of some of these tumors that we could be talking about? We have ovarian tumors. So sometimes you can develop cysts in the ovary, right? And these cysts may be cancerous or non-cancerous, but because the cyst is there, then each time there's thrusting, it can lead to compression of that cyst and cause pain. Sometimes even rupture of the cyst, causing inflammation or bleeding internally. You can have also issues where you have, for example, uterine fibroids, especially if they're large, distorting the normal relationship between the structures on the inside. You can have, consequently, pain during deep penetration or thrusting. All right, so that's the causes of deep dyspareunia. All right, so I think we've covered a lot in this video. We've spoken about why it's important for us to really have a discussion and to understand about pelvic pain and pain during intercourse. We've covered the fact that dyspareunia or painful sex can be classified into two types, whether it's superficial or deep, and depending on whether or not it's superficial or deep, actually gives us a clue as to what the underlying cause might be. We've gone into the varying causes. And so we understand now that it's important for us to actually have an idea of this condition and therefore know what to do about it. So that's it for this video. I hope that was useful for you. If this was the first time for you, understand that this channel is devoted entirely to supporting women, empowering them through quality health education. And if that's important to you as well, then make sure to smash that like button, subscribe, and share this video so others can also benefit, and we together can help women to live healthier, happier, more fulfilling lives. All right, so this is Dr. C signing off for now. Until next time, stay happy, stay healthy. Have a blessed day.